I slipped on a rock and I actually fell hands forward on this blade. My hand slid down the whole thing. Hi, my name's John Maroulis. I'm a patient at Dr. Iyer's. I live in Califon, New Jersey, and I met him through an accident. So I have a pond in my backyard, and every year I have to remove water chestnuts. They're an invasive plant, and they have to physically get torn out. At the time that I was doing it, it was July 10th, 2022. It was a beautiful day. I go out there, and I was using this big tool. It's a Y-shaped, it's about 6 feet tall, and it has blades on the side of it. So you kind of attach it to yourself, you throw it in the pond, and then you pull it back out to cut the water chestnuts. I was wearing waders, and as I'm coming outside of the pond, I put the tool on the shore of the pond, and because my feet were wet, I slipped on a rock, and I actually fell hands forward on this blade. My hand slid down the whole thing, so I severed my tendons and my nerves in my left hand. The slice basically had my hand in like two pieces, so I had to sit down at the moment because it was bleeding profusely, and my son came to the door because he heard me yelling for help. The ambulance came, they binded my hand as best as they could, and I was taken to Morristown Memorial. At that time, Dr. Iyer, when I got to meet him, he gave me some options. He told me basically it was an extremely bad injury. The damage was extensive, and he basically, at that moment, the option was to do surgery, and he didn't know how much movement I would be getting back. I did not have the surgery right after that. I had to wait about a week. At that moment, he did sew me up. His bedside manner is extraordinary. He spoke very well. It was just like, it was a relief. The day of surgery, I go in, he talks to me. I was nervous. I've been in surgery before, but this was, just to hear his voice. And like I said, his bedside manner is like so positive. So like, I felt like I knew him. He told me like everything's gonna be good, and we did the surgery. Afterwards, he said it was very successful. Everything was good. So immediately after the surgery, everything was it was very numbing. They had me on nerve blockers. It was very painful, but like I said, it was relieving. It was like the pain you could feel it. It was very hard, but at least when he said it was successful, that was the most optimistic. It gave you a light at the end of the tunnel. And at that moment, he told me I'm gonna have to start physical therapy right away. So I saw him a couple days later. He put me in physical therapy the next day, and it was just, it was the best advice he could tell me at that moment. He was like, you gotta work hard, you gotta really push in order to get it. He's like, if you let it sit there, if you let the scar tissue build up, it's not gonna heal. It's been about probably so it was July 2022. It's probably a year and a half, a little bit more than a year and a half. My motion, if you look at my hand, I can open it, I can close it. If I close it, if I physically close it, I can hold my fist. My strength, I work out, my strength is almost completely there. And about 6 months ago, my strength had increased exponentially. I use it, I write, I have no problem. As far as feeling goes, I have feeling in all my fingers. Of course, the circulation, it gets a little bit cold, but it's understandable because the nerves are growing back super slowly. And just to show you, the cut was cut from here all the way around my hand. So what advice I would give to somebody, the same advice Dr. Iyer gave to me. He said to me, whatever you put into it, you're gonna get out of it. I would 100% recommend doing the surgery. The occupational therapy, you have to jump on it immediately. Sometimes it was very overwhelming. Like, I work out, I come home, I do the occupational therapy. Sometimes I was more pooped from doing the therapy, and at first you're just moving like a couple centimeters, and it was just so tiring but it totally pays out. It pays off, and it's you have to be aggressive with it. And he told me that from the beginning. If you're the more you put into it, the more you get out of it. And he was 100% right.